chat. So hello to CHWs, Promotoras de Salud, CHRs, our allies, CHW network and association and coalition leaders from across the country. I'm really excited today to be in the presence not only of my staff members, Bernadine Mafhugo, who's been hosting the webinar today, but also Aurora Grant Wingate, who is our new member and partner coordinator. So NACHW is growing. But I'm also really honored to share this webinar with Theanvy Kuoch, who's been my mentor and colleague for many, many years, and Darrell Fox, I think many know, a giant in the field. I call him an OG CHW lovingly, and also a founding board member of the National Association of CHWs. Want to spend just a moment giving you a quick level set on some of the work and perspectives that NACHW has been involved with, talking really today about amplifying CHW roles, experiences, and capacity during COVID-19. So the National Association of CHWs was launched in April 2019 after many years of organizing of CHWs and allies from across the country, and the support from so many different organizations and thought leaders. Our mission and our vision is to unite CHWs nationally, and I always say across geography, across sector, and across experience, to support communities in achieving health, equity, and social justice. During the COVID-19 pandemic, we have been hearing from our members and our partners and allies from across the country. In March, because of the request of CHWs, to help them find the information that they needed to be able to respond personally and professionally to the pandemic, NACHW launched a webpage called the COVID-19 webpage Resources for CHWs. We enjoy thousands of visitors a month since that website launched in March, and we invite you to view the site and to suggest additional content that we can put there that is relevant to the roles and the competencies and the environments where CHWs work and serve. I just want to highlight a couple of our national communications. We've been very fortunate since April 2020 to be able to partner with the American Diabetes Association, ASCO, the Centers for Disease Control and Prevention, and more recently, the Community-Based Workforce Alliance, which was really launched by a strategy call from Rishi Manchanda in Health Begins, really trying to just get out into various settings and promote and articulate the roles that CHWs can play as first responders during this pandemic. Very recently, NACHW partnered with the Morehouse School of Medicine as part of their multi-year funding with the Office of Minority Health to help launch a national initiative to mitigate and build resiliency among communities that are experiencing severe vulnerability and impact, economic and health impact of COVID-19. Here, I'm just referencing Aurora Wingate's contact information and some of the roles that NACHW will play in this growing national initiative. You finished the poll, so hopefully many of you are interested in learning more. Please reach out to Aurora. I'll have her put her contact information in the chat, or you can visit the Morehouse and CERN website for more information. Our message, as we've been talking nationally, has been just a couple of really strong talking points that I want to emphasize today. CHWs and our networks, associations, and coalitions can provide essential, critical public health infrastructure during COVID-19. CHWs were classified as essential critical infrastructure workers by the U.S. Department of Homeland Security back in March 2019. And since that time, we have been partnering with all of the organizations. You sort of see their logos at the bottom of this one pager to try and amplify and articulate ways in which public and private institutions can authentically partner with and integrate CHWs into their COVID response. CHWs have a role to strengthen public health capacity. We can offer during this time of COVID response the development and provision of compassionate community engagement. We can support screening communities and families for social and behavioral health needs and help them to navigate or coordinate those services. We can support workforce development activities, including recruitment, hiring, training, and supervision of a COVID response CHW workforce for testing, contact tracing, and now as we turn toward vaccination distribution. And we can help lead community capacity building and recovery efforts. CHWs are also promoting equity and social justice during this time. NACHW was proud to partner with Khmer Health Advocates. One of our speakers is the ED, and she'll be presenting a little later, as well as with the Austin Asian Community Health Initiative to develop this one-pager on ways that CHWs from every ethnicity and background can support Asian American and Pacific Islander communities during this time. Many of you know that there has been a sharp increase in violence and stigma against Asian American and Pacific Islander communities. COVID-19 is having a professional and a personal impact on CHWs. And so I was very proud to partner with a few of our board members, researchers, Susan Macefield Johnson and Ashley Wennerstrom, as well as CHW state leaders from across the country, Delantria Bryant, Kim J, Milagrosa Seguino, Treva Smith, Nicole Moore, Jolisa Castillo, Sarah Crosby, Catherine Haywood, again, additional board members from NACHW, to really draw out insights of the ways in which COVID-19 is having this impact on the profession and on CHW's personal lives. As some of the talking points here on the right, I just want to highlight, we heard from leaders that we need to, we, NACHW, and our partners and allies need to promote, protect, and pay CHWs as essential critical infrastructure workers, create a workforce infrastructure to really respond to the physical and psychosocial mental health needs. We need to continue to share and lift up insights to adapt and improve COVID-19 response. And we need to integrate CHW leadership and voices in the design and the development of these response strategies. We need to encourage CHW engagement in local, county, and state CHW networks, and strengthen and support CHW self-care and support the development of targeted approaches to address the concerns. Many CHWs across the country, but in particular our community health representatives on tribal nations, are often fighting COVID-19 with very limited resources. And I just want to lift up here an article that came out in the Journal of Ambulatory Care Management, written by Paige Menking and Majeline Begay, two board members of NACHW, and one of our allies, Lee Rosenthal. Would love for you to read this article. You can find it on our COVID-19 webpage to get more information about the experience of fighting the pandemic on the Navajo Nation. CHWs can also be partnered with during this time when we are thinking about vaccine development and distribution to build authentic trust and confront the historic barriers that many Black and Indigenous Americans are facing. Many communities, I think, to be frank, have a level of skepticism about the vaccine. And if we do not have confidence and trust and communication, we will not have widespread desire to be vaccinated among all Americans who can gain access to it. NACHW was proud to release a joint statement on racial equity and vaccine development and distribution in partnership with Health Leads and many other partners. And we invite you to click on the link to read the statement and to sign on as an individual or organization if you are so led. And finally, I want to say that for the last 6 months, NACHW has been lifting up the innovation that has been coming out of CHW leaders activities and our CHW networks. Here on the slide, you can see a number of different organizations who are members and partners with NACHW, the Sankofa Community Connection, the Mass Association of CHWs, A Vision of Change, Inc., the Florida CHW Coalition, Essentially Empowered, and Dia de la Mujer y su Familia. These are partners, but they're experts in their own right who've been innovating on training, on community engagement, and partnering with public and private institutions to further policy or program development in response to COVID-19. And so today, I'm really proud to be able to lift up an opportunity and environment for more CHW leaders. As I mentioned, I could not be more proud to be present here today. I'm going to turn the webinar now back over to Bernadine Mafugo, who's really the host for the day. Bernadine, thank you so much for bringing everyone here and for all the work that you did to make this happen. And I look forward to the rest of the webinar. Thank you to everyone. I'll continue to say hello in the chat, and I pray that all is well with you and your families and your communities during this time.
Thank you, Denise. So I have gone ahead, I placed it a little earlier and I've put it again, the NACHW COVID-19 resources page. The link is now in the chat. So please feel free to peruse the page after this session. All right, I would now like to get started with our two presenters. And just for some housekeeping, we are going to have both presentations happen, and then we're going to have a Q&A portion after they've both gone. So please hold any questions, but in the meantime, you are free to place any questions you may have along the way in the chat. We will make sure to circle back to them and ask them during the Q&A. So first up is Mr. Darrell Fox. Mr. Fox is a community health worker with over 28 years of experience providing outreach, direct services, case management support, and advocacy for HIV positive adolescents, young adults, and their families and communities. He currently serves as a CHW Health Equity Consultant at John Snow, Inc., and recently served as a technical advisor for the Massachusetts Department of Public Health's Prevention and Wellness Trust Fund, which employs over 70 CHWs across the state. He is a proud member of the CHW workforce and continues to serve in a volunteer CHW role, coordinating and staffing a Young Men's Rites of Passage program. Since 1991, Durrell has been involved in local, state, regional, and national CHW workforce development efforts, including serving as one of the founding members of the CHW section of the American Public Health Association, the American Association of CHWs, the Massachusetts Association of CHWs, the New England CHW Coalition, the Advisory Work Group for the Massachusetts CHW Board of Certification, and the National Association of CHWs. So take it away, Durrell.
Oh my goodness, I didn't know you were going to read all of that. Hello everyone, welcome. I want to give greetings to everyone, and I'm honored to be part of this NACHW event today. And this is kind of a redo of an event we did for the CDC CHW Task Force, CHW Day for CDC employees back in September. I want to thank all of you all for taking time out today and for taking action to assist communities in addressing and navigating COVID-19 and the many issues that surround it, including access to testing, treatment, contact tracing, and equitable vaccine education and access. You've heard a little bit from Denise about that. I want to take a moment to honor all the people we have lost in the current storms of the COVID-19 pandemic, racial injustice, electoral politics injustice, and yes, the record number of storms and hurricanes. For all who we've lost through the storms, I ask you to say their names, say his name, say her name, and continue to honor their memories. Today, I'm going to focus on CHWs in the Black community in the age of COVID-19 and some of our roles of CHWs as frontline workers who are an essential part of a critical workforce who many times are the first responders to families and communities in crisis, and we've done that for many, many years. This here is just a brief outline of what I'll be covering during our journey today. The CHW scope of practice, including our core competencies, core roles, core skills, qualities, and attributes, provide a solid foundation for our workforce to prepare for and to respond to pandemics, storms, diseases, illnesses, and yes, inequities. So I'll talk a little bit more about that and how we are skilled at addressing all of these, primarily by addressing the many social determinants of health and the determinants of health equity that assist our clients and communities by building and enhancing the preventive and protective factors against some of these ills. CHWs are partners in achieving health equity and enhancing health literacy to build community capacity and resilience when facing pandemics like COVID-19. So we really, truly need additional support and continue to support to fulfill our role. I'll share some of my experiences as a CHW focused on HIV/AIDS for about 25 years in the early 90s through whatever 25 years later was, to today, as one of the examples of how CHWs have been activated to address pandemics in the past. For centuries, the Black community has always had natural helpers, elders, caregivers, who were part of the community and who provided the kind of support and services that CHWs provide. And in recent years, CHWs have played a critical role in the Black community, and I'll discuss some of those roles today. I will note that interest is high in our workforce, and I've seen that ebb and flow over 3 decades that I've been in the field. So I know we have to work to sustain the interest and ensure resources and support are sustained beyond any one crisis or pandemic. There is a need for more support for CHW's role in addressing COVID-19 to match its interest. And I'll share some examples of how we've been adapting and using innovations. And Denise shared some of those as well. I use those words, guys, because as I mentioned, this was designed for an audience of CDC staffers. And so I deliberately used some of the words that I just shared with you. The coronavirus pandemic has had severe effects on impacts on the Black community. I developed this slide this summer, and there has been much more data and much more information shared and learned every day. So I won't spend a lot of time on it, but I wanted to share a couple of things. We've heard Dr. Fauci recently talk about the fact that institutional racism in the United States contributes to the disproportionate impact that the COVID-19 pandemic has had on the Black community. He's also noted that some members of the Black community, as well as other communities of color, may not be able to socially distance if they're in roles and jobs as essential workers. And there's also a disproportionate prevalence of underlying conditions within the Black community, such as high blood pressure, diabetes, obesity, chronic lung disease, kidney disease, and others. We all know this, but it's very important to hear this from our leading scientists and policymakers in the country. While helping a reporter research a story exploring how the crisis of COVID-19 and racism overlap, a cardiologist named Clyde Yancey at Northwestern University recalled he had insight that he found chilling, and that was he realized that his personal risk of death may have less to do with COVID-19 and more to do with the color of the skin. Based on data reported by 40 states, Yancey said 1 in every 1,850 Black Americans, African Americans and Blacks, died from COVID-19. It's a mortality rate that's 2.5 times approximately than for whites. Another way to think about it, that statistic is that if Blacks were experiencing COVID-19 at the same rate as whites, 13,000 more Blacks, and this is from September, would be alive today. This disproportionality is real. The numbers are sobering and stark. I included some data from Louisiana on this slide, and you can look at national or state-based data each day and see some of the same or even greater disparate impacts of COVID-19 in Black communities and other communities of color across the country. The data represent clients and family members. We have all seen some of these disparities in COVID-19 cases, hospitalizations, and adverse outcomes, including deaths. The data is alarming and sobering. Now I just want to shift to say that the reason why we're talking about CHWs and COVID-19 right now is because CHWs have a solid foundational core of roles, skills, and qualities that are aligned with the guiding principles and values that hold trusting relationships with the clients and communities we serve as paramount. And that is the formula for success. That is what has placed CHWs in this role to actually assist our communities of color address COVID-19 and respond to COVID-19. Again, I want to share this image. It's a reminder of nationally recognized CHW Core Competencies for those who may not be as familiar that are listed in the National CHW Core Consensus, also known as C3 project findings. These 10 core competencies are foundational stones that are designed to support and uplift additional competencies in specific disease areas, emergency preparedness, and pandemic response, to name a few. We, community health workers, are a workforce that stands at the ready, and we need the tools and support to fully realize our potential and our roles in the response to COVID-19. Thank you. So I'm going to stop here, and I'm going to ask you guys to take a journey with me. Imagine you have a novel virus, and it's detected in a community that you live in. Imagine that during the early days of this virus, maybe even for several years, there were not a lot of facts about the virus, but there are many myths and inaccuracies, inaccurate information about the virus. Imagine that there's no specific testing or treatment for the virus for a long time. Imagine some people, families, and communities live in fear every day and are deeply impacted and affected by the virus. And then imagine at the same time, there are many other people who think the virus is somebody else's issue or problem and that it won't impact or affect them. Can you imagine that, guys? Can take a moment. Well, imagine that I'm not really talking about COVID-19 right now. I'm talking about HIV from my experiences over 25 years or so working as a CHW case manager for adolescent HIV program. For 3 decades, CHWs have played a continual and continue to play a role that's essential in HIV/AIDS alongside patient and system navigators, linkage coordinators, clinical providers, and on clinical and community teams. In the early days of HIV, CHWs were doing many of the same things that they're doing now to respond to COVID-19. So we know how it can be done. We also know you need the community and political will to truly overcome a pandemic. We didn't have widespread access to testing in the early years. Many people actually had to wait 2 weeks for a result, and sometimes more. That was the Western blot test. So we worked with clients related to risk reduction. We educated them about the window time period, which is the time that the testing that we had available was could not detect the virus, but that you may have it. Does this sound familiar today, people? And so I think we have a model for success. On the screen, you just see several things that community health workers worked with and addressed during COVID, during HIV pandemic. I shouldn't be trying to read the chat, guys. And one of the things that we truly did that we're doing now is around COVID-19 is we developed advocacy and policy skills. We really expanded those a lot. We had organizations you see on the right side of the screen, like ACT UP, AIDS Action, the Black AIDS Institute, NMAC, and other places that really helped hone some of our skills related to that. We also, there were CHWs who've been in the field for years, but HIV was new. So we basically expanded our knowledge base around HIV/AIDS. So we had CHWs working in asthma, diabetes, hypertension, and those folks began to learn and understand HIV/AIDS. And we also had the growth of a whole group of CHWs who focused on HIV/AIDS. We also had to develop heightened awareness across communities and generations with trusted sources of real solid information, particularly in the early years of HIV/AIDS, but I also would say even today. We developed culturally appropriate HIV prevention education, similar to some of the initiatives now that CHWs work on to create culturally appropriate COVID-19 education. Community outreach was a big piece of what got ramped up to address HIV/AIDS. Partnering with and connecting with CBOs and faith communities, we find that happening also related to COVID-19 response, and also case finding. I will also note that part of what we worked on and did over those years was around education and access to HIV and STD counseling and testing. Again, something happening with COVID-19 as we try to address the lack of access, and also disclosing status and partner notification, which can be similar to contact tracing. So once again, the tools are there. We know that we can do this work. And I'll watch your cues, Bernadine, because I can't look at the chat if you're trying to reach me. but I'll watch your expressions.
You're fine. Keep going.
Okay. All right. Next slide. So CHWs have been addressing some of the conditions that put Blacks at higher risk for adverse outcomes when contracting COVID-19. This includes diabetes, hypertension, obesity, and cancer. As I mentioned, this image is from the Prostate Health Education Network, which is known as PHEN. It was the first time I had heard of the very important concept of having to be physically distanced, but particularly for the Black community and other communities of color, having to get, be, and stay socially connected in order to overcome COVID-19. There are many CHWs like myself who work in men's health, who have attended PHEN events and webinars and added lots of tools to our toolbox to assist our clients living with prostate cancer and other cancers in navigating COVID-19 world, where contracting the virus can lead to adverse outcomes with a high risk of that adverse outcome being death. This image is from a webinar that took place on March 11th, which by Dr. Keith Crawford of PHEN, and it was entitled "The Pandemic and Prostate Cancer." And the bottom line is that was very early in the epidemic, so that heightened awareness among many of us community health workers. It helped us be proactive in reaching out to men of color living with prostate cancer to provide prevention education, safety education, and also in some cases to provide PPE and other resources, including jobs and stuff like that, and housing. Some of the things that we've continued to do as CHWs is expanding our COVID-19 knowledge base and skills. We've been doing that since day one of this epidemic. We've been attending webinars, virtual training programs about COVID-19 from basic to advanced topics, including some of those hosted by the National Academies of Science and Engineering and Medicine, sessions on equitable COVID-19 vaccine allocation. We've been researching and locating new resources to bridge the digital divide, which has been a critical component to addressing COVID-19. We've been researching COVID-19 testing sites to increase access to testing as well as to PPE. We've been increasing housing insecurity knowledge due to clients losing income in their housing at a more frequent rate than in the past. We've been addressing food insecurity, which has been a major jump for some of the clients that some of us have worked with that never were insecure around food. We've been addressing major spikes in behavioral health support needs, including within our own workforce, which I'll close by talking about self-care. We've also been enhancing some of our emergency preparedness and readiness tools and skills. I've already talked about how we've been addressing some of the underlying conditions, and there are organizations like NACHW, the National Community-Based Workforce Alliance, which you heard about, the Navajo School of Medicine-led National COVID-19 Resiliency Network, which you heard about from Denise, and then the many CHW local, state, and regional networks. Shout out to you. You guys have been compiling and sharing resources within our CHW community pretty much daily, and CHWs have been tapping into those to serve our communities and other communities that serve our communities. There are also many more efforts to address COVID-19 that I haven't talked about in the Black community that may be near you, that you're aware of or involved in. I urge us all to have platforms like this to continue to share some of these programs that are happening. And I'll stop there. And this is just one thing I just heard about from a CHW in Louisiana. It's called the Skin You're In, Coronavirus in Black America, and it's helping CHW disseminate facts and share information. This is one of the many social marketing campaigns developed to help dispel myths and raise awareness in the Black community about staying safe and healthy throughout the COVID-19 pandemic by providing accurate and relevant information about COVID-19 effects on Black Americans for this project in the greater New Orleans area, but there are many, many more out there, and I just wanted to share an example. All right, y'all, self-care. Well, I mean, what can I say? We are a workforce that have basically been risking our lives for years and risking the safety and health of our families to save other lives and to put an end to this crisis and many other crises that we face. The coronavirus pandemic has completely shifted the way of our practice for CHWs, our regular every day-to-day work, and other frontline health workers as well. And it has had a significant impact on the behavioral, mental health, and well-being of our workforce. So you'll see here some of the things that CHWs have done. I urge everyone here who works with CHWs to continue to take care of yourself. We've also had heightened communications related to occupational health and safety. Shout out to Rick Raven, who I think I saw on here. He's been helping us. This is something that some of us haven't addressed fully over the years, and this has been really critical to our safety to learn these things. When I did this talk for CDC, I put this slide up here, and I said some words because I just wanted them to understand what I feel, and I feel that some people understand, and that is that we had a diverse panel of CHWs representing diverse populations in the U.S., and we all work together so we know we're not alone in this journey, and that also provides us with the courage and strength to move on, to go on. As the Black National Anthem says, stony the road we trod, and bitter the chastening rod, but still we march on till victory is won. We also understand that we are all connected, and when we assist our different communities in navigating COVID-19 safely, we know that the life we save or the COVID-19 infection we prevent may be our own, or it may be yours. And finally, I want to close out with a quote in the spirit of John Lewis. And this is kind of embodies the spirit of community health workers in our role in COVID-19. When you see something that is not right, not fair, not just, you have to speak up. You have to say something, and most importantly, in the role of community health workers, you have to do something. I want to thank you all so much for your time, and now I pass it back to you, Bernadine.
Thank you so much, Darrell. That was great. And everybody, people are sending in their questions. Please continue to do so, and also responding to the prompts that Denise had also placed in there. All right, so now I'm going to share for Theanvy. Durrell, can you confirm to me that you can see the screen?
Yes, ma'am.
All right,
Yes.
great. Okay. All right, I am now going to introduce Theanvy. Theanvy Kuoch is a survivor of the Cambodian Holocaust and came to the United States as a refugee in 1981. She founded and has directed Khmer Health Advocates since 1982 and is currently the chair of the National Cambodian Health Initiative, which was founded in 2003. She holds a master's degree in refugee mental health and contextual family therapy, and provides therapy as part of the KHA torture treatment team. In 1991, President George Bush named her the Point of Light for her volunteer work with refugees. So please take it away, Theanvy.
Thank you. Could you back a little bit though, please?
Oh, yes, of course.
One more, please.
This is the first one.
Oh, that's the first one, okay.
Yeah.
Well, thank you very much, especially, for the introduction. Also, I would like to thank to Denise, leading, the community health worker in Connecticut and nationwide. And that's the very important task, that I always pray, that things gonna happen. But Denise had made her way, and I really deeply appreciate it. And also it's gonna make a lot of sense. The community across, the world is gonna using community health worker, and they're gonna feel safe. I feel comfort, and they feel that somebody alongside them, and they can understand, they can help them, they can reduce the obstacle and rebuild the resources. I think COVID-19 at this time, it's just really fearful to all the community across the nation. I like to say that good afternoon. I am pleased to have this opportunity to talk with you about the vital role of the community health worker in the time of pandemic. COVID-19 is one of the greatest health crises we have faced in 100 years. But for most of us, it is not the first crisis we have faced. Once again, my name is Theanvy. I am a survivor of war, torture, and genocide from Cambodia. And I came to the United States as a refugee. And in 1982, we found Khmer Advocates, a nonprofit organization with a mission to care for the health needs of the Cambodian survivors and their families. Along the way, I have served as the chair of the Southeast Asian American Health Coalition in Connecticut, a board member of the National Asian American Pacific Islander Mental Health Association, and was appointed to the advisory board of the state of Connecticut Health Innovation Project. And I would just like to say that the Southeast Asian here in Connecticut, the total we have about 20,000, consists of Vietnamese, Cambodian, and Laotian. For the 4 decades that I have been a community health worker, I have done outreach, surveillance, health promotion, interpreting, counseling, research, and advocacy. I have learned many lessons. Some lessons was pretty easy, others was very, very difficult. Today, I would like to share some of them with you, hoping that they can help during this pandemic time together. Lesson 1, health and healing happens in community. Next slide, please. All of our community are rich in culture. We have been helping one another to stay alive, to stay healthy and heal for thousands of years. Our languages have words that saying, that soothe and comfort us when we are afraid and ill. Our rituals and ceremonies are vital for reducing stress and giving people hope. The community health workers is the key to helping communities survive during this dangerous time. The power of the community comes from giving and takes. I take care of my people, and they in turn give me information, feedback, and support. When we help each other, we discover new ideas, and we give each other the energy and strength to make life better. Every person has their own power. The community health worker job is to remove barriers and build resources so that people can use their own power to heal. Our ethnic community are interlinked with other communities such as healthcare, education, research, and advocacy. The role of the community health worker is to give voice to their community within the greater community. Next slide, please. Lesson 2, a crisis really is an opportunity. Change happens faster in a crisis than at any other times. People who never know each other come together to solve problems and help each other. This creates a bond and reduce isolation. It can help a community grow as well. It also breaks down all prejudices and help us see people in a new light. The sharing that happens during a crisis is the foundation for new hope to end disparity. Out of crisis comes new relationships and the potential for teamwork to improve the health of our communities. Next slide, please. Lesson 3, we need to have a plan. Community health workers need a plan for today and a vision for tomorrow. There is no one plan for solving problems, but there are many plans for how we can think about solving problems. At Khmer Health Advocates, we develop the community care model, our blueprint for knowing what we need to know and doing what we need to do to solve problems over time. CARES stand for communication, access, resources, education, and strategy. We need to plan for helping our people through COVID-19 pandemic. We need to ask many questions. Communication. Can our community communicate effectively about this COVID-19 virus? Do they have information in the native language? Can they read? Do they have the ability to video conference with their healthcare provider? Can they call for help in an emergency? Access. Do they know how to get healthcare? Know that clinic and offices are closed. It's very difficult, especially when you cannot speak the language and you just don't know how to communicate it. Do they have transportation? That's it's very important as well. Can they get testing? Well, easy enough, if you can speak the language, you can, well, you may be afraid, but you can, find out how to get testing. But once again, when the people do not speak the language, it's a very, a huge gap in that. Resources. Do they have the human resources that they need? Do elders know how to get food? Because a lot of time, I think that, you had mentioned that I came from war, torture. A lot of people, when they came to the United States, all their family died. Sometimes they have only 1 or 2% that they alive, so they came to the United States. And those people have a problem with social isolation. Do they have family? Do they have a health insurance? Here in the United States, if you don't have insurance, you can't get the services. Education. How do community health workers teach them what they need to know to be safe? How can we protect them from scam and conspiracy theory that cause stress? People who come from war and torture, they already have stress, have chronic, complex diseases. And, this, going to be double and triple stress that they will have to carry on. Strategies. Strategies require that we work closely with the community to collect information, assess what we know, and decide on our priority. It requires that we seek out the young generation as well as the old and find those who may have gotten lost. Next slide, please. Well, lesson 4, I think we talk about the hard stuff. Next, please. I'm sorry, I go back one more, please. COVID-19 pandemic is a major health problem. Racism and genocide are also major public health problems as well. The burden of illness falls very heavily on people of color who are at greater risk due to the stress of trauma. People of color are more and more the essential worker and frontline caregivers. We often go home to multi-generational households where it is impossible for people to social distance. Some family, they have a lot of people and then it's very difficult for them. We know from other experiences that treatment and tests are developed for the majority population. It may not be effective for our community. Even though now, since I think that, lately, we know that the testing available and also the vaccine may be available, sometime next year, early next year, but it's still very difficult. That's why community health workers have a very important, role, and trust with the community that they can organize community to get those things. Lack of disaggregated data creates misinformation about who is at risk. The myth of the moral minority promotes a belief that Asians have a few problems with health and with racism, when in fact, many have the same disparity as other people of color. I think this thing we need to get the data, and this thing we need to talk about. We need to talk more about it, so we won't left, any community behind the scene. Next slide, please. Lesson 5: the work of the community health worker happens in a circle, not a straight line. Next, please. As community health workers, we share the burden of suffering in our communities as well as the blessing of bond that give us strength and hope for the futures. We need to be able to look closely at the problem while you try to stay calm. We are frontline workers, often community health workers, are first person to be called in an emergency. For many of us, the stress and loss that come with COVID-19 can trigger our own post-traumatic stress disorder. We need to space ourselves and rely on each other. We need to work in a circle, not a straight line. This means that we need to be in the pace setter for solving problems, because some people may be slower, some people may be less educated. So we have to set, the pace in a different way. We are cycling together until our community heals. I mean that, each family, each person, there is so many things going on. So we need to cycling to find what is the priority that we need to do first and second and third. We are resources for each other. We are family, neighbors, friends, religious leader, giver and holy blessing, fortune teller, shaman. We help bring our community together, the old and the young, the sick and the well. those in need and those who can help. It was amazing that I will found out that even though the people are very sick, but they still can do something to help people as well. Understanding, caring, and sharing will get us through this difficult time. And I hear Durrell, say the same thing. If we hold our hand, work together, sharing together, that's the power of healing. Regardless what color, regardless what problem, if we work together. And once again, we can get through this very difficult time with the COVID-19 pandemic if we all work together with compassion, care, and through our whole heart. And thank you very much for listening to my presentation.
Thank you so much, Theanvy. This has been absolutely enlightening, and the chat is on fire today. So I see there have been some questions asked in the chat that have also been answered by others and by Denise, who our executive director, who's in the chat. So if you have, in our last few minutes, if you have a question to ask, I'm going to ask that you raise your hand. So raising your hand, if you look at the bottom menu on your Zoom, there should be a little hand that says raise your hand. And if you do that, I will be able to unmute you and you can just ask your question live. And if you asked a question earlier and it was answered in the chat, but you'd like to ask it of our two speakers, please raise your hand as well and I can unmute you or have you unmute. We're getting a lot of thanks in the chat, which is great.
Great.
So before we wrap up, anybody, last chance for some questions. I don't see any hands raised.
Oh, wonderful.
Yes, I say if they're quiet, it means they loved everything. Wonderful. Oh, yes, lots of thank you in the chat and lots of excellent presentations.
Oh,
wonderful. All right,
wonderful.
so before we wrap this up and before I let everyone go, again, please, if you have any remaining questions, place them in the chat. And even if you don't get to them today, we will be saving this chat and reviewing it. So if you put your contact information or anything in there, we will be able to have someone reach out to you. You can also reach out to NACHW via our email, which I am going to place in the chat right now. And that is info@nachwa.org. So you can please reach out to us there. You can also go on our website. So if you go to www.nachwa.org, that's NACHW, you will be able to find at the top menu, there is a button that says connect, and that'll give you a form through which you can get in touch with us. And again, please visit our COVID-19 page. We currently have these slides uploaded there, but they will also be sent out via email. The email you use to register for this, you will also receive them there, and we'll also post them on our Facebook. So follow us on Facebook if you don't already. And please, if you are not currently a member of NACHW, please consider joining. You can reach us, you can learn more about membership at www.nachwa.org/membership. And I can link that right now as well. So please, yeah, please consider becoming a member of NACHW. There are lots of benefits and you can join as an individual or as an organization. And there's membership for CHWs, for allies, for ally networks or CHW networks. So yes, in the last minute, if anybody has anything else they'd like to add, please go ahead and raise your hand and I will lift you up. Otherwise, it was wonderful to have you. We will be sending out the recording, which will be posted on YouTube. So we'll send you the link. We'll also send you links to the presentations. And if you have any questions, please reach out to us at info@nachwa.org. All right.
Well,
thank you so much.
Thanks again, Randy, and thank you for, you're a wonderful host, and it was, thank you so much was nice meeting you, through the video conference. I hope to meet you sometime as well.
Thank you so much, Theanvy. And
And then the end, I just want to pray to God that to bless all of us, to be safe, through this, pandemic. So we'll be alive and we'll see each other face to face again. All the world has to be safe. That's my prayer.
thank you. Thank you so much.
Thank you again, Theanvy. Thank you again, Darrell Fox. Thank you again, Bernadine Mafhugo. To all of the NACHW board members who were on, Ricardo and Lisa Renee and Lily. Thank you so much for your continued support. To our members, we thank you so much for your feedback and your support of the work that we're doing. We want to hear from you, so use all of the mechanisms that we have, Facebook and our Connect page and our info email, to continue to reach out and let us know what you're doing and how we can lift that up, and whether or not what we're doing is supportive of your work at the local level. Be safe, everyone. Yeah, blessings to all of you, and have a wonderful, if very different, Thanksgiving.
Glad to have you as a leadership on the community health worker, Denise.
Yes.
Thank you,
Have
Theanvy.
my bless.
Thank you, my friend.
Great.
Okay.
All right. Bye, everyone.
Bye. Take care.
Bye-bye,
Have a
everyone.
wonderful Thanksgiving. though.
Bye. Happy Thanksgiving.